For those of you still joining us and just recently coming in, welcome to our webinar. We'll be joining shortly and starting audio, so just continue to check that audio using the call-in number if needed below. We'll give it maybe one more minute or so to allow folks to join. Right, it says some people we are noticing are hearing an echo. We'll continue to work on that. Let us know if you're continuing to hear that audio issue. But for now, let's go ahead and begin. Hello, my name is Brittany Stuber with the Patient Advocate Foundation. Welcome to our first webinar in our multi-part series, Empowering Patients Through Financial Help, introducing TotalAssist. Before we begin, I have a few quick reminders to share. We are recording today's webinar, and the recording will be shared with all registrants via email in the coming days, along with the slides and other helpful resources. If you have a question during today's webinar, please submit it to our team using the Q&A feature. We'll do our best to answer your questions, but please note that we are unable to answer questions about individual specific grants or medical situations. Closed captioning is available within the Zoom platform, or if you're watching this live streamed via YouTube. And if you need technical assistance during the webinar, please use the Zoom support link or message the host. I'm pleased to introduce you to today's speakers. First, we're going to have Fran Costello, the President of Operations here at the Patient Advocate Foundation. She will be joined by Jennifer Brewster, Vice President of Financial Support Programs, and James Ridley, Director of Clinical Affairs. We have a packed agenda for you. After our introduction, Fran will be sharing a little bit more about our recent merger with the PAN Foundation. Then she'll introduce our new patient assistance program, TotalAssist. James will walk us through the details of TotalAssist, including our fund list and eligibility requirements and processes for applications and claims. Next, Jennifer will review how our legacy grants and programs, including the Copay Relief Program at the Patient Advocate Foundation and the Patient Assistance Program at the PAN Foundation, will work for those with existing grants. We will close out today by sharing the TotalAssist launch timeline, as well as information on how patients and caregivers, providers, and pharmacists can prepare. We'll take a few of your most frequent questions live today, and then end with next steps, including details on how to register for the second part of this webinar series. And with that, I will hand it off to Fran Costello, President of Operations.
Thank you, Brittany. Good afternoon, everyone. My name is Fran Costello, and I'm the President of Operations for Patient Advocate Foundation. We're so glad that you could all join us today to learn a bit more about our merger and TotalAssist. As many of you know, Patient Advocate Foundation and the PAN Foundation announced a strategic merger in March of 2026. The strategic merger of PAF and the PAN Foundation created the nation's most comprehensive nonprofit dedicated to helping patients navigate, access, and afford the care that they need. We are so excited to come together. The merger was a direct result of the continued increased challenges that people experience accessing prescribed care. As many of you on this call know, the healthcare access and affordability challenges only seem to be getting worse. More people are struggling to pay for care and manage chronic illness, and the safety net system is continued continuing to be stretched thinner. This means demand for help is at an all-time high. In fact, PAN and PAF saw a collective 15% increase in financial assistance enrollments in 2025 and a 25% increase in requests for help from a PAF case manager. The Patient Advocate Foundation and the PAN Foundation realized that together we have more reach, more resources, and a more powerful voice to directly assist and advocate for patients. We wanted to share a bit of that combined reach and impact. Over the past combined 50 years, Patient Advocate Foundation and the PAN Foundation have supported patients with chronic, rare, and life-threatening diseases. Together, we have served 3.8 million patients, and we've distributed over 7 billion in financial assistance. We've also served 350,000 patients with our case management services. In addition to those direct service milestones, we've engaged in powerful advocacy and educational initiatives aimed at helping patients and providers navigate the healthcare landscape and expand access to care. We've also shown a commitment to academic and scientific research on issues related to healthcare affordability and access, and we continue to partner with nonprofits nationwide to help deliver critical patient support programs. Our strategic vision for the future is simple and bold. We want to enable more people in more places to access the care that they need to live long and healthy lives. You can see here that the vision has many parts, but today we're going to be focusing on TotalAssist, our consolidated and combined financial assistance program that will be launching on July 1, 2026. TotalAssist will be the largest and most comprehensive patient assistance program in the nation. So I'm sure that all of you really want to know, what does this mean for patients and those that you serve? What does it mean for you if you are a patient or a loved one that you're caring for? And we want to answer those questions today. What it means for us as a starting point is that you and those you're serving are at the center of all of the work that the PAN Foundation and the Patient Advocate Foundation have done for years and will continue to do together. As a combined organization, we can serve as a single trusted destination for getting you and those you serve the help that they need. Combining forces also allows us to expand our capacity and our reach, which gives us the ability to serve more people everywhere. This merger also means simplifying the experience. Fewer applications and centralized resources translates to less administrative burden and less confusion for those helping patients find assistance as well as patients themselves. And finally, combining our efforts allows us to build stronger systems and partnerships nationwide to help move the needle on health equity and access to care. So let's talk a little bit about TotalAssist. You've probably heard this term in the market. You've seen some announcements from all of us coming out since March, and we wanted to spend some time today digging into the details. Launching on July 1, TotalAssist will become the nation's largest charitable patient assistance portfolio. The program will have over 140 disease funds spanning chronic diseases, rare diseases, cancer, and more. And it's designed with flexibility and real-world care in mind. So what does this look like in practice? TotalAssist means comprehensive coverage and assistance. First, patients can use their grants for a wide range of expenses, including medications, insurance premiums, office visits, and other treatment costs. Grants are awarded for a full rolling year, so unique award years for each patient based on their enrollment date. Income eligibility is going to sit at or below 500% of the federal poverty level for most all of the funds in TotalAssist. We will also be adjusting that income based on the cost of living index and household size to ensure that we normalize income no matter where a patient lives. Our funds are disease specific, not medication specific. This means that grants cover all medications or products that are FDA approved to treat the disease named in the fund, as well as those listed in compendia guidelines. Finally, our guaranteed grant model is designed to meet the out-of-pocket costs for patients with an initial award meant to cover most expenses for most patients, with the flexibility to obtain additional funding as needed based on the availability of funding. So what does Total Assist cover? When we launch in July, all Total Assist funds will allow patients to utilize their grant funds for their medication copays, coinsurance, and deductibles related to those covered medicines. We will have a list of approved medications for each Total Assist fund, and it will include every FDA approved or product or those listed in published guidelines and evidence-based publications. It also covers grants can also be used to cover health insurance premiums of all sorts based on the insurance type that the fund covers. This includes individual coverage or the individual's portion of a family plan if they are on some sort of group plan. Office visit copays on the day of treatment, as well as administration charges related to the treatment, will be eligible for payment directly to the providers themselves or as a reimbursement to patients. One important and exciting note here, patients will be able to enroll in more than one Total Assist fund. We know that many individuals manage multiple diseases. So if, for example, you have heart failure and COPD, you can actually enroll and receive funding to support your out-of-pocket costs for both disease states, as long as you meet each fund's eligibility guideline. So let's touch briefly on what Total Assist does not cover. And these are illustrative examples of large categories of expenses that are not covered by Total Assist. So medications that are not listed on a fund's approved medication list. So supportive medications, for example, are generally not going to be covered. Products not covered by insurance. This is not a change to either of our programs. This is actually consistent with how operations are today. Obviously, in a copay assistance program, the insurance needs to cover the medication, even if the copay is at 100% because of a deductible. But if the health plan does not cover the product at all, the program cannot cover it either. Products billed only for pharmacy discounts card, only billed to pharmacy discount cards, like GoodRx, for example, are not eligible for payment with the grants, medical devices, lab work, surgeries, and radiation therapy and scans. Our goal is a simplified patient and user experience, and there are several ways that we're going to affect that. I want to speak specifically to the portals. There are going to be some webinars in June speaking really in great detail of our portals, but I do want to share that we will be launching a new Total Assist portal that will enable your access to all active patients. I think that's a really important message for this audience. If you are a registered user in the PAF Copay Relief portal, or in the PAN portal, we are going to be consolidating those registrations and those patient accounts into the Total Assist portal. And so when you log in on July 1st, you will be able to access all of your active patients, regardless of which program they were enrolled into initially. There's legacy patients in the copay program, as well as the legacy patients in the PAN programs will be there in your under your registration. And then as you enroll new patients or re-enroll patients, they will be enrolled into the Total Assist program, which will also be accessible as part of that same view. We're trying to simplify this so that you don't have multiple portals to log into and or to remember passwords and usernames. We're going to provide a bit more detail in the coming slides on the portal, as well as some webinars dedicated to our provider and pharmacy audiences in June. And lastly, I would like to share a new feature that will be forthcoming in the next little while, which is a real-time fund notification system. This is going to be specifically related to the Total Assist launch. It is going to give you users a place to go to sign up and choose what funds you would like to be notified about when they open, as well as how you would like to be notified. We will offer omni-channel communication methods to include SMS text, phone, as well as email. Users can select any or all of those communication methods, and you will be able to change those preferences over time, change how you'd like to be communicated, or add funds to the list of funds that you would like to hear get updates about. I do want to touch base. We've been asked this a lot. Fund Finder is not going away. It will be rebranded, but other than that, it will still be very much available in addition to the program, the Total Assist real-time fund notification system. The Total Assist real-time fund notification is obviously specific to the Total Assist program, while Fund Finder is broader than that and will provide you information on fund openings across the charitable patient assistance landscape. So I want to make sure to make that point. I appreciate the opportunity to share a bit of high level information with you about Total Assist. I'd like to turn it over now to my colleague, James.
Thank you, Fran, and thank you all for joining us today. As mentioned earlier, I am James Ridley, the Director of Clinical Affairs here at Patient Advocate Foundation. And as someone who works closely with patients, providers, caregivers every day, I know firsthand how overwhelming the healthcare journey can feel, especially when financial barriers stand between the patient and also the care that they need. That's exactly why we are so excited about Total Assist. What we're launching is more than a financial assistance program. It is a patient-centered experience designed to simplify access to care, reduce stress, and support people in real, meaningful ways throughout their treatment journey. Over the next several slides, I'll walk through what patients, providers, and pharmacies can expect, including eligibility requirements, our disease fund portfolio, grant structure, and how the application and claims process will work. So let's get started with eligibility. While eligibility criteria can vary slightly by disease fund, there are several core requirements that apply across most Total Assist programs. To receive assistance, patients must have a confirmed diagnosis for the disease state covered in the fund. Also, patients must either be actively receiving treatment, preparing to start treatment within the next 60 days, or receive treatment within the past 6 months. Applicants must have qualifying health insurance that covers the eligibility expenses, or the eligible expenses rather. And for most funds, household incomes must be at or below the 500% of the FPL level. And just to help put it in a little perspective, for a family of four, that's approximately $160,000 annually. And it is important to note that we also recognize that healthcare affordability varies from where someone lives. That's why we incorporate cost of living adjustments and household size into our evaluations. We want to create a model that reflects real world patient experiences, not just numbers on paper. Patients must also be U.S. citizens or permanent residents receiving treatment in the United States. And finally, I'll note that if a patient is using their grant for medication-related expenses, the prescribed therapy must appear on the approved medication list for that particular disease fund. Next slide. But one of the exciting aspects of Total Assist in this breadth of support that we are able to provide. At launch, Total Assist will include more than 140 diseases and health equity funds spanning across chronic diseases, rare diseases, oncology, and non-disease specific services. These funds were intentionally designed to reflect the realities of modern healthcare and the growing complexity of chronic disease management. We see support across cardiovascular disease, autoimmune conditions, pulmonary disorders, kidney diseases, neurological disorders, rare diseases, cancers, and many, many, many more. We also include several non-disease support funds because we recognize that barriers to care extend way beyond just medications alone. And while the slide contains a lot of information, the most important thing to take away here is that we are building one of the most comprehensive charitable patient assistant portfolios in the country, designed to meet patients where they are. A full and current list, including the grant amounts, eligibility criteria, is available online at unitingpatientadvocate.org. And beginning July 1st, it will also be available on TotalAssist.org. One areas I am especially proud of our continued commitment is to health equity. And I repeat that again. One area that I am most proud of is our continued commitment to health equity. Total Assist includes more than 20 health equity focused funds developed specifically to support communities experiencing experiencing significant social and financial barriers to care. To build these programs thoughtfully and responsibly, we use data-driven methodologies to incorporate CDC disease incidence data and also social vulnerability index. Through this work, we identified counties across the country experiencing both high disease burden and also high levels of social vulnerability. Eligibility for these diseases are determined automatically when the patient's zip code is used during the application process, which helps reduce the administrative burden for patients while improving access. And also, most importantly, these funds represent our commitment to ensuring that where someone lives does not determine whether they can access treatment or assistance. Next slide. So, in addition to the disease-specific funds, Total Assist also includes several non-disease and supportive service programs. These include support for transportation, cancer genetic and genomic testing, virology testing with a health equity lens, and social needs assessments and interventions. Excuse me. Why is this important? One, because we know access to care isn't only about medications. That's just one portion of it. Sometimes the biggest barrier is transportation to treatment. Another is sometimes it is the diagnostic testing and also unmet social needs impacting patients' ability to remain engaged in care. What we wanted Total Assist to better reflect the full patient experience, not just a component of it. And patients can enroll in both disease-specific funds and also these supportive service funds if they meet the eligibility criteria. Now let's talk about grant amounts and how funding works under the Total Assist. So assistance amounts vary by disease fund, but the overall model is designed to cover 100% of the out-of-pocket costs for patients within the covered disease area. We're using that and we're calling it the guarantee grant model. That means patients receive the initial guarantee funding amount intended to meet the majority of the anticipated out-of-pocket expenses during the 12-month grant period. For example, on the slide, you see a patient in the breast cancer fund with the initial guaranteed amount of $3,500 and up to an additional unguaranteed amount of $3,000 that is available based on funding. One thing to highlight and note, and please remember, one feature I think patients and providers will really appreciate is that if a patient exhausts their guaranteed amount before the end of the eligibility period, they may automatically access additional support simply by continuing to submit eligible claims. That means there is no need to make another call or restart the process. That flexibility is incredibly important because healthcare costs are unpredictable, and we want our assistant model to better reflect the reality. Now, now that we cover the funds themselves, let's walk through what the patient, the provider, the pharmacy experience actually looks like. From application to claims processing, one of the biggest priorities during the development was simplification. Patients are already managing enough. Navigating assistant programs should not feel like another burden. Applying for Total Assist is designed to be straightforward, four-step process. First, check to see if the fund is open, either online at totalassist.org or by calling the support team at the number provided on the slide. Secondly, review the eligibility requirements using our online eligibility tool, which helps patients guide through the process quickly and clearly. And third, gather the patient's information are needed to apply, including diagnosis information, medications, insurance details, contact information, healthcare provider information. And finally, submit the application either through our online portal or over the phone. From start to finish, the process typically takes less than 15 minutes, and in most cases, patients receive a decision almost immediately. One thing to note that the speed matters because when patients are facing treatment decisions, waiting weeks for financial assistance answers can create an enormous stress and delay to care. We wanted to remove as much friction from the process as possible. Next slide. So to maintain the program's integrity and to ensure compliance, all applications undergo verification. This includes diagnosis verification and also income and identity verification. Every application must include an approved diagnosis documentation reviewed by our verification specialist. And importantly, providers and pharmacy staff can help verify diagnosis directly during the application process, either by phone or within the portal itself. Applications can also be screened in real time through our verification systems. If income or identity cannot be verified electronically, we understand the application simply moves into a pending review status, and the patient can submit acceptable documentations for a manual review. Our goal here is to balance strong program stewardship with a compassionate patient experience. We want the verification requirements to become an unnecessary barrier to care. Now, let's finally talk about the claims processing. TotalAssist offers multiple ways to submit claims, including virtual pharmacy cards, online portals, fax, and mail options. For pharmacy claims, processing occurs in real time using the virtual pharmacy card through participating pharmacies. Medical claims, insurance premium claims, provider claims, and patient reimbursement claims all can be processed internally through our TotalAssist expenditure team. We also recognize that not everyone engages with technology the same, so we intentionally maintain multiple submission pathways to meet patients where they are. And just a reminder, the second webinar in this series will focus specifically on TotalAssist portal experience and key workflows for patients, providers, and pharmacies to include claim submissions. So at the end of the day, everything we're building is centered around one goal: helping patients spend less time worrying about healthcare and more time focusing on their health, their family, and their lives. And with that, I'll transition things over to Jennifer.
Thank you so much, James, for that wonderful overview of TotalAssist. So my name is Jennifer Brewster, and I'm the Vice President of Financial Support Programs here at Patient Advocate Foundation, soon to oversee the TotalAssist program. And I know everyone's here today to learn about TotalAssist, but I know users are interested to see what to really expect for our legacy grant users for Patient Advocate Foundation Copay Relief Program, as well as our PAN users. So we're going to move forward and go over that today. Next slide. So first we will review our PAF Copay Relief Program grants and what to expect. So the good news is PAF CPR grants that are awarded on or before June 26 will be unchanged. So no changes to those patients that have already received a grant on or before June 26. All CPR legacy grants will remain active throughout their entire award period, as long as they're utilizing their grant and they're utilizing, submitting claims into the program. And as a reminder, patients must submit a claim within 120 days to keep their grant active. There's no changes to patients' award for their covered expenses. So, there continue to be coverage for copays, coinsurance, deductibles, related to their medications and prescribed treatment that manages and supports their diseases. We still will continue to cover medical insurance premiums, office visits a day of treatment, as well as administration charges. All right, so let's talk about the CPR legacy grants and managing claims. So you would still use your existing pharmacy card, so no changes to that. So even as we move over into TotalAssist, as you have an active grant, you would still use your existing pharmacy card. And you can continue to submit claims from now into June 26, either in the portal, through patients, providers, or pharmacy portals. You can also fax them into the program as well as mail them. Now, beginning July 1st, once TotalAssist launches, CPR users will then log into the TotalAssist portal. You would use your same email and password. So any registered user for the CPR portal use the same password and the same email to log into the TotalAssist portal. Just wanted to highlight that our call centers and our portals will be down from June 27th through June 30th as we prepare for the launch of TotalAssist. Thank you. So let's talk about our copay relief legacy grants for renewals and also re-enrollments. So for grants expiring on or before June 26, you will follow your current PAF CPR renewal rules and use the existing portals. So if my application is due to renew prior to June 26, you would still log in and apply if funding is available to our existing copay portals or call into the program. Now, starting July 1st, you would then call into the 866-512-3861 number, but then you would apply on the portal at totalassist.org. And then for grants expiring after June 26, starting July 1, as long as funding is available, you can enroll in a TotalAssist grant beginning the day after your current grant expires. And as Fran highlighted earlier, patients can also apply to more than one grant. So renewals and re-enrollments will be unavailable, just as a reminder, from June 27th through the 30th. All grants are always awarded on a first-come, first-served basis if funding is going to be available. All right, so let's go through a couple of scenarios for our PAF legacy grant users. So Nancy has an active breast cancer grant through PAF Copay Relief Program. She was enrolled in April 1st of 2026 this year, and her grant is due to expire next year, April 1st of 2027. She is allowed to apply for a renewal grant in our TotalAssist program next year, April 2nd of 2027. So Nancy's CPR grant will continue under the legacy program until it expires on April 2nd of next year. As repeating, her renewal grant in 2027 will be in TotalAssist grant since her renewal window is after July 1st of 2026. So some things that Nancy or her provider can do now are continuing using her CPR copay card, pharmacy card through the end of her eligibility term to make sure that those claims are coming through. And between now and June 26, she would still continue to log into the PAF CPR portal until June 26, and then starting July 1st, any claims that needed to be submitted or information on her account, she would then log into the new TotalAssist portal. During that time, she could also review to see if there's any other grants that she would qualify for, as we've stated before that patients can now apply for more than one grant. All right, so let's go through another scenario. So example number 2. David has an active pulmonary hypertension grant through our copay relief program. He was enrolled in June 28th of 2025, which is last year, and his grant is due to expire this year on June 28th of 2026. He's allowed to apply for a renewal grant using the TotalAssist program on July 1. Now, due to downtime, since his award expired on June 28th, he has to wait until July 1st. So David's CPR grant will continue under the legacy program until it expires. And because David's renewal period occurs during the downtime window, his renewal grant will be a TotalAssist grant, and he will be able to reapply on the 1st as long as funding, of course, is available. Now, some steps that David and his provider can take now are continue using his CPR copay card and submitting claims until the end of his award period. And that would be through our PAF CPR portal. And then starting July 1st, if funding is available, he can reapply. For example, if the fund is closed, he could sign up using our notifications tools to sign up for fund notifications. And then he can also review to see if any other funds are available for him that he would be able to apply for. All right, so let's talk about our CPR legacy grant status and getting help. So now through June 26, patients, providers, and pharmacies can log into their portals and review any legacy grant status information that they may need, or call into our program and ask any questions that they have regarding existing applications. We do ask that if you do call into the program that you have the patient's full name, date of birth, fund information if available, as well as their application or grant ID. We also ask that you have a contact phone number and email. In the event the call gets disconnected, we can call you back. And just to highlight again that the call centers and portals will be unavailable as we transition to TotalAssist June 27th through June 30th. And beginning July 1, when we launch TotalAssist, as you notice that the phone number is still the same. So it would still be the Patient Advocate Foundation number, 866-512-3861, or you can also visit the TotalAssist portal for assistance. Next slide. Okay, now that we've highlighted our legacy CPR grants, we are now going to move forward with reviewing our legacy PAN grants. All right, so what to expect? So PAN grants awarded on or before June 26 will remain active throughout their entire grant period as long as grant use requirements continue to be met. And those grant requirements are that patients have to submit a claim every 120 days to keep their grant active. As just a reminder, we do send to patients a 60-day reminder notice to submit claims before their application would close out. So let's talk about some covered expenses and expansion for our PAN legacy grants. So existing copay grants are eligible for expanded covered expenses starting July 1. So starting July 1, PAN grants will cover what they cover now, but they're also getting expansion to cover copays, coinsurance deductibles for covered medications, medical insurance premiums, office visits, copays the day of treatment, and treatment-related administration charges. So it's really going to benefit those legacy patients with those expanded covered expenses starting July 1. Premium grants or covered expenses are staying the same, so only covering those insurance premiums through that. And transportation grants for the PAN legacy patients are staying the same as well, using that prepaid Visa card for the transportation expenses. There is no change to the current policy for the utilization. That is staying the same. So I really do want to focus and highlight the renewal timing change. So beginning May 1st, notification was sent out. PAN legacy grant recipients can no longer renew early. So beginning May 1st, renewals will open the day after a grant expires, like they currently do for our Patient Advocate Foundation Copay Relief Program. So patients cannot renew until the next day after their award expires. Also would like to highlight that there will no longer be waitlists in place starting July 1st with the TotalAssist program. So we will offer the opportunity for patients, providers, and pharmacies to sign up for real-time TotalAssist fund notifications when funds open. They can receive those notifications via email, text, or by phone call. So let's review managing claims for PAN grants for today through June 26th and then starting July 1st. So just another highlight, great news, claims will continue to be processed using the existing pharmacy card for the patient, so no change to that. They will continue using their pharmacy card until the end of their award period. So from today until June 26, any PAN legacy grants, they would continue to submit claims through the portal by fax or by mail that's listed on the screen. As a reminder, June 27th through the 30th, our call center will be closed, and then we will reopen with the TotalAssist program beginning July 1. And beginning July 1, all claims you could submit through the portal or faxed into the program that's listed below. All right, let's discuss some renewals and re-enrollments for PAN grants. So for grants expiring on or before June 26, you can renew your grant using the existing PAN portal or call the call center prior to June 26. Now, starting July 1st, you will use the TotalAssist portal and call the call center at 866-512-3861 to then, submit claims or also renew if you're due to renew and funding is available. Just to highlight again that we already discussed on the last slide, PAN grant recipients cannot have an early renewal. Renewals will open the day after a grant expires. And then for grants expiring after June 26, starting July 1, you would enroll in the new TotalAssist program beginning the day after your grant expires. And you could log into the portal or call our call center for additional help. Reminder that grants are awarded on a first come, first served basis if funding is available. All right, so let's go through a few examples for our PAN grants. So PAN Financial Assistance Program. So Jane has an active rheumatoid arthritis RA grant through the PAN Foundation. She was enrolled on June 1st of 2025 last year, and her grant expiration date is June 1st, 2026, which is this year. So if funding is available, she is allowed to apply for a renewal grant on June 2nd, 2026. So if the RA fund opens before July 1st, Jane's renewal grant will be a Legacy PAN Financial Assistance grant. If the RA fund opens on or after July 1st, Jane's renewal grant will be a TotalAssist grant. So some actions that Jane and her provider can do now between now and June 2nd is continue using her PAN copay card through the end of her grant. And between now and June 26, she can log into the PAN portal. If the fund opens, she can apply to renew her grant under PAN. If not, we encourage people to sign up for the TotalAssist fund notifications so that way that she would be notified when to apply. And then starting July 1, they can log into the new TotalAssist portal. And if she is approved, then she can manage her grant through the new TotalAssist program. All right, so let's go through another example for the PAN Financial Assistance Program. So Patrick has an active prostate cancer grant through the Legacy PAN Financial Assistance Program. He enrolled of May 10th of 2026, so this year, and his grant expiration is May 10th, 2027, which is next year. He's allowed to apply for a renewal grant on May 11th of 2027. So Patrick's PAN Foundation grant will continue under the Legacy program until it expires next year on May 11th. His renewal grant in 2027 will be a TotalAssist grant since his renewal window is after July 1st of the TotalAssist launch. So some actions that Patrick and his provider can do now is continue using his PAN copay card through the end of his eligibility term next year. Between now and June 26, he can continue to log into the PAN portal to submit claims or review any application information. And then starting July 1, he can log into the new TotalAssist portal, submit claims for medical insurance premiums, all those expanded services that we covered earlier. And then he can also review to see if he qualifies for any other grants outside of his prostate cancer. So now verifying Legacy PAN grant statuses and getting help between now and July 1st. So now through June 26, PAN Legacy grant statuses can be reviewed through the PAN portals or by calling into the call center, the numbers on the screen. If calling, we just ask that you have the patient's name, date of birth, fund name, grant ID if it's available, and the contact phone number and email. And June 27th through the June 30th, as a reminder, call centers and portals will be unavailable as we transition to launch the TotalAssist program beginning July 1. And then beginning July 1, you would call the 866-512-3861 number or visit the new TotalAssist portal. Now let's talk about what to expect and launch timeline. So what happens before July 1st? So between now and June 26th, all current grants continue without interruption. So we're trying to really make it as easy as possible for all of our users for PAN and CPR legacy. Patients and providers continue using their existing portals through June 26 at 5:30 p.m. Eastern Standard Time. Most eligibility and grant terms remain unchanged except for what we did highlight earlier, which was that we no longer have that early renewal grant for PAN grants. So they would have to wait until the day after their award expires in order to apply if funding is available. New and returning patients can apply for assistance through either Patient Advocate Foundation Copay Relief Program or PAN's Financial Assistance Program. Please note again the downtime, June 27th through June 30th. This is the time where we are going to be transferring and transitioning the PAF CPR and PAN call centers and portals will all be unavailable during this time. Grant enrollments and re-enrollments for our patients will also be unavailable. Next slide, please. So what happens on July 1st? TotalAssist launches. TotalAssist program will replace legacy programs. All new grant applications, renewal applications will go through our unified program, TotalAssist. Existing legacy PAN copay grants will have expanded coverage to include health insurance premiums, office visit copays, a day of treatment, and treatment-related charges. All other legacy grant coverages remain the same. So how do you get in contact with us on July 1st? You can visit our portals at totalassist.org, or you can call into our 866 number to receive one-on-one assistance from our contact center staff. We will have our updated and branded patient, provider, pharmacy, and nonprofit partner portals will be available. So all portal data from our PAF CPR portals will be migrated. So just to highlight for the legacy CPR patients, they will use their existing password and email address to log in. The PAN portal users will use their existing email, and they will be prompted to change their password once they log in. So, and for all PAN portal data, for all active users, all of that data will be migrated within the last 12 months as long as the portal users have logged in. And currently active or expired applications from January 1st, 2026 or later will be migrated all to the TotalAssist portals. So we really are going to focus on having that centralized hub for financial assistance programs, portal access. We're going to have a help center on our website as well as an eligibility tracker. And as we launch, all patient communications will now be branded under the TotalAssist program name and branding. Now that concludes how to prepare. So we're going to turn it over to Fran Costello.
Thank you so much. If I can get my video back on, please. Thank you so much. So what can you do to prepare? So we have created some one-page guides to help you prepare for the launch of TotalAssist. Each guide covers key information and activities that you might need to complete before July 1. There's one for patients and caregivers, and then there's a checklist for providers and pharmacies. These are printable resources, and they're going to be shared with all attendees following this presentation, and they're also going to be available on our microsite, which is uniting.patientadvocate.org. So we encourage you to go there and download those checklists. I've been monitoring along with many of my colleagues all these great questions that are in our Q&A within this webinar. We're going to get to all of them either throughout the course of the session or afterwards on follow-up. So thank you for sharing those questions with us. You also, and I would encourage you all, based on some of the questions I'm seeing, to register, look out for information to register for our next webinar. There are going to be two, one on Tuesday, June 23rd at 1 p.m. That is going to be a portal focused webinar. So all things portal for providers and pharmacies. So if you're a member of a provider organization or a pharmacy staff, I would encourage you to take the time and plan to be with us on Tuesday, June 23rd at 1 p.m. As is the case with this webinar, we will record it. We will send it out after. So at a minimum, do register. Even if you end up not being able to join, you'll get it, the recording as follow-up to your registration. Then on June 25th, we are going to have a second webinar about portals that will be focused on and specifically for patients and caregivers that are assisting patients and managing those individual patient portal accounts. So we would invite you to join us on June 25th at 1 p.m. For that webinar. If you are a patient who's joined this call, or you know somebody that you're working with or are a loved one to or caregiver for, to join the webinar and learn more about the TotalAssist portals. While there are some things that are changing, we're doing our best to not change too many things because we understand the importance of consistency. So consolidation and consistency for all audiences is foremost in our mind. I do want to put a note out here because I saw a couple of questions from some of our nonprofit portal users. So Patient Advocate Foundation currently offers a patient partner portal that is uniquely and specifically for case managers, social workers, and sisters of other sorts that work within our nonprofit partners and nonprofit community. So 501c3 nonprofit organizations. That portal will also be available in our TotalAssist suite of portals. And we will be hosting a separate webinar for those users post-launch. But just know that if you're already registered in the PAF patient partner portal, your registration, all of the same information that you use today to log in is what you will use as of July 1st to log into that same portal for our nonprofit users. So just wanted to touch on all of those audiences. All right. So obviously lots of questions, a little bit challenging environment with thousands of people to take questions live. We did get some good questions prior to the session, a few of which we're going to cover here, and then one or two that I've seen frequently in today's question set. So one of the questions we got is, do TotalAssist funds have to be open to apply? And the answer is yes. Obviously, as is the case now, in all programs, all charitable assistance programs, the funds have to be open and available to accept a new application. It works the same way currently in both legacy grant programs. Patients won't be able to apply to closed funds. We are sunsetting the wait list. That was I understand that there are mixed feelings about that, and we appreciate those. And it has its own benefits as well as its own challenges, but it's a decision that's been made to sunset the wait list. So we will need to, as users, wait for funds to be open to apply. That is one of the reasons that we are launching the real-time fund notification system that gives 3 different ways for you to be alerted, because we recognize you're not always available and in front of your email when a fund might open. So there will be more information coming out about how to sign up for the real time notification system. If you're already signed up on a wait list with the PAN Foundation, you will automatically be enrolled into our real-time fund notification system. And you will not have to take any action to get on the list. You will receive a communication asking you to go in and update your preferences. We'll enroll you into the fund or funds for which you were sitting on a wait list. But if you want to get notices about more than those funds, as well as update your communication preferences, because it'll be defaulted to email, you will have instructions on how to do that prior to July 1. If you are a copay relief user, or you're also a copay relief user and you're signed up on one of copay reliefs listservs to receive fund notifications, you also will be automatically enrolled into our real-time notification system. You too will receive an email asking you to go in and update your preferences. So if you're in both systems, you're going to have one consolidated account within the real-time fund notification system, and you will have the opportunity to go in, as I mentioned, select all the funds that you would like to receive notifications about, as well as how you would like to be communicated with. So another question that we received before this session, as well as I've seen it a bit in the questions that have come across. So if you currently have a PAN or a PAF CPR grant, am I automatically enrolled into TotalAssist on July 1? Or can I switch over to TotalAssist? So the answer is no, you will not be automatically enrolled in TotalAssist. We will be consolidating all of the patient accounts. So whether you're a PAN grant recipient or a copay grant recipient or a newly enrolled TotalAssist grant recipient, all of those patient accounts will be managed by one team under one brand, which is TotalAssist. You will have one phone number to call. You will have one portal to go to be able to access all of that patient information, all of those patient accounts. So while we're consolidating for the sake of being as least disruptive as possible to our users, your grant itself will still remain as a PAN legacy grant or a PAF copay legacy grant through the end of that grant term. So once those grants expire, and assuming that person needs to re-enroll, at that time, they would then re-enroll into a TotalAssist grant. We do want to point out some exciting changes for the PAN copay grant recipients. Those grant recipients, while still retained as, retaining their legacy grant, will be able to utilize and take advantage of that expanded coverage that TotalAssist offers, to include all the items covered by TotalAssist grants. So insurance premiums will no longer be managed as a separate grant. They can actually be covered through the copay grant, as well as those copays that might be due for an office visit on the day of treatment, and the administration charges related to therapy. So please note, if you have an active legacy grant, so when July 1 comes and you have a copay grant or PAN grant, you cannot apply for a TotalAssist grant for that same disease until that legacy grant eligibility ends. You can, however, apply for a TotalAssist grant for another disease if that is a need that you have and meet the eligibility requirements. And last but not least, I know we're at the end of our time. Will Fund Finder still exist? I mentioned earlier, yes, it will. So this will be a tool in addition to our real-time notification system that if you're signed up, there will be no change. You will continue to receive notices from Fund Finder. I want to thank you all for your time today. And just as we're closing out, share with you there are some other ways to engage with Patient Advocate Foundation. We do have our Spring Innovation Summit coming up on May the 14th. Later this week, we encourage you to join. This is Clinical Trials Awareness Month. There's some information on the PAN Foundation website regarding that. And I want to just say thank you on behalf of Patient Advocate Foundation, PAN Foundation, our TotalAssist team, our board and leadership. We thank you for your commitment to patients, for your willingness to help us be better, for your ongoing support of those that you serve. And if you're a patient and we're serving you directly. Thank you for that opportunity, for putting your trust in us to help you with your affordability and access issues. We look forward to our next webinars in June. Please watch your inbox. We will be continuing to send out information, and we'll look forward to answering the questions that we have not yet gotten to in this hour. Thank you so much.